Welcome. I am Dr. Jan Lemon, and we're going to be talking about counseling research and the contemporary issues concerning that, and also ethical considerations in research. There's a lot of objectives covered in this section, but mostly we're going to be looking at the importance of research and counseling and some of the very foundational issues involved. Why research? We're therapists. Why do we have to worry about research? Well, we are beginning to have to pay attention to the efficacy of our practice. That means, are we using evidence-based treatments that have been proven to work for those particular mental health problems? With counseling research, there's the scientist-practitioner model. That means we're going to marriage together the scientific part of counseling with the art of counseling. That is, we want to have a toolbox that is full of evidence-based models and techniques that can be used along with the art of connecting, the art of understanding and being aware of your client. In 1970, managed care began to come into the mental health field. And managed care was saying that we want to make sure, if we're going to pay for it as the insurance, that it's evidence-based and it's going to be a help to the client. And so they begin to have certain objectives to make sure that the number of the sessions and the treatment was very effective. Let me give you some examples. Adolescent depression. We know that different types of cognitive behavioral therapy works for that type of mental health issue. Borderline personality disorder. We know dialectic behavior therapy works. So those are evidence-based therapies and treatments that managed care would recognize that the insurance company would want to pay for that. There are different roles that have been delegated to the practicing counselor in the area of research. First of all, we are producers of new data. We're constantly seeing clients, so we are producing new data in that area. We are also consumers of research. If you have a client that comes in and they have a mental health issue that you have not treated before, you may have to go do some research to see what method, what techniques, and what model you may need to use with that client. And lastly, we are evaluators of effective therapy. The old saying that if you drive from Madison to Jackson and you're not there 2 hours later, well, you've probably taken a wrong turn. It's the same way in therapy. If you've seen a client for 3 months and there's no improvement in the client, you need to evaluate that therapy and see if there's something that you need to do differently. It's important for counselors to acknowledge the importance of data being utilized. What are you going to do with that data? You're going to determine the focus of treatment. You're going to design appropriate interventions. And finally, as we've already said, you're going to evaluate outcomes. Now, there's another model besides just the scientist-practitioner model, which the SP model is what we call it, and it is probably the most used and the one that I like the best. The database problem-solving model, it's more of a component of behavioral consultation and work, which is not my favorite, but it does provide rapid assess needs, it monitors symptoms, and evaluates outcomes. It has a real emphasis on problem identification. When researchers are doing research on counselors to see if we are effective, they look at two things. They look at the effective counseling model, and they also look at the aspects of the individual counselor that affects outcomes. Um, they have found, research has shown, 70% of successful therapy is based on individual factors of the counselor. I find that fascinating. And they're really, regardless of the model you use, it's your own compassion, connection, ability to connect with that counselor that really makes counseling effective. There isn't a signature profile for counselors. You don't have to look Freudian. You don't have to speak a certain way. There's really no signature profile. Neither demographic variables, professional identity, you're going to find this fascinating, nor years of practice have significant impact on the outcome of the counseling process. You could be a counselor for 20 years, but to become an effective counselor, there are three things, and I cannot emphasize this enough. It's a blend of relational skills, analytical skills, and intervention skills. That's what really provides successful counseling. Relational skills, that you can connect with that client on a level where they feel like you really have compassion and care for them. Now, there's been lots of research done on connection. We know it is more than just sitting down with a client, that there's actually something physical that takes place. Anytime you're within 3 feet of a client, you are beginning to almost give off frequencies to connect with that client. And there's something called mirror neurons that you begin to produce. And those mirror neurons can be picked up by the client's brain, and they begin to produce mirror neurons. So there's a real awareness of connection there. The second thing is analytical skills, and I love this because very concrete people have a lot of problem with analytical skills, and it's something you're really going to have to practice. Why do art therapy if you're not going to analyze it? I love psychoanalytic techniques. If you're going to do sentence completion, you're going to have to analyze what that means if they complete that sentence a certain way. So this is something you're going to have to practice. And the last one is intervention skills, and that really kind of gets into that scientific area. You're just going to have to make sure your toolbox is full of all kind of techniques, so that's when I believe the Holy Spirit takes over and enlightens those intervention skills so that you can use those in an effective manner. And I could talk for an hour on different ways that that can happen. Counseling research, we're going to be talking a lot about qualitative, quantitative, and mixed methods. And you'll know exactly what those three areas mean in research. There are certain central issues to research, and some of those are ethics, multiculturalism, writing, and reviewing the literature. There are some basic components with research, and we'll be really getting into each one of these individually, but going over those basic components now. The research question, probably to me the most important aspect of the study. If I have a good research question, I can go carry out that study. A research question is a statement of the problem and its significance. Now, let me give you a couple of good examples. Do drug prevention programs at the elementary school level reduce actual drug use by the participants? Very simple question, very simple study. What is the effect of a peer mentoring program on the recipient's attitudes about school climate? Now, I could take those questions and I could immediately go begin a study. So the research question is very important. The second thing is the hypothesis, and I could talk all day about the hypothesis. Remember, the hypothesis is nothing more than an educated guess. Now, I said educated because it is, it's a tentative or potential answer to your proposed problem. But you've done a lot of study in the related literature. And so, as I said, it's an educated guess. And we'll be talking later on about the null hypothesis. And we'll talk about the alternative hypothesis in research. Variables. Your variables are so important. Let me give you a great example. When I did my dissertation, I was very interested in high school dropout. So my dependent variable, and we'll talk about both of those, is was at-risk status for high school dropout. My independent variables to see if they affected that or stress, wellness, and mattering. Very different constructs that usually people looked at for high school dropout. So those variables are any characteristic, quantity, or attribute that can change or vary among subjects over time and can be measured or manipulated. Research to science, we've already talked about, we'll be talking about three. Quantitative, which is very numerical, analyzed statistically. Qualitative, which is narrative, a lot of storytelling. You might like that type of a study. And then we'll be looking to see what is a true experiment, what's involved with a true experiment. Sampling is also important. Of course it is. It's going to be your population. Who are you going to use in your study? Now, remember, I gave you the example of my study. Here I was looking at high school. So I had to decide what kind of sample I was going to use in that study. Of course, it would be high school students. Random sampling is when everyone has an equal chance of being selected. And it's really the best way of providing a sample. But there's also systematic sampling. And systematic sampling includes something, convenient samples, which really most people use. People rarely use random sampling because it's very difficult. We'll look how difficult that is. Systematic sampling is choosing who you want to use for your population. I chose all the students in the high school in the 9th through the 12th grade because they were convenient. They were there for me to use. And so that would be a systematic sampling. Many research analysis will tell you exactly how many participants you need in your sample. So let's talk a few minutes about ethics in research because it's very important, just as important in your private practice. The ACA Code of Ethics in Section G have a whole section on what is ethical in research. Those decisions are related to research practice, and they include some very important aspects. Number one is informed consent. In your practice of counseling, you have an informed consent, which includes all the information about your counseling practice. The same way when you're doing a research study, do you have an informed consent which your participants must read and sign, which tells them what you're going to do, how you're going to do it, when you're going to do it, and what are you even going to do with the information after the study is over. Also, in your decision making, you've got to make sure you ensure best treatment for your client. And that can be real tricky. I mean, I could give you example after example. My cousin had some issues with circulation to her foot, and they were thinking about removing her leg below the knee, and she was part of a study. And it was random sampling in the study. Well, if she had not gotten the treatment, she could have lost her foot. And so you can imagine if you were the one doing that study, how are you going to work out those ethics if she doesn't get randomly selected? She did, thank goodness, and it did work. The treatment did work. And then you want to make sure you ensure client confidentiality, whether it's during the publication or afterwards when you are actually writing this up. Research ethics, as with everything, doesn't provide specific answers, but it does give you really good judgments on how you should carry that out.